The alarming rate of maternal and infant mortality in Nigeria. The Senate further notes that statistics have shown that every single day Nigeria loses about 2,300 under 5 years old and 145 women of childbearing age. The Senate is concerned that Nigeria is the second largest contributor to the under 5 and maternal mortality rate in the world. The Senate is further concerned that research has shown that essential intervention reaching women and babies on time is capable of averting most of these deaths. The Senate is aware that preventable and treatable infectious diseases such as malaria, pneumonia, diarrhea, measles, and HIV and AIDS account for more than 70% of these deaths. Further aware that malnutrition is the underlying cause of morbidity and mortality of a large proportion of pregnant women, newborn, and children under 5 in Nigeria. The Senate is worried that the death of newborn babies in Nigeria represents a quarter of the total number of deaths of children under 5, and majority of these deaths occur within the first week of life. The Senate is further worried that a woman's chance of dying from complications during pregnancy and delivery in Nigeria is 1 in 10 births. Although many of these deaths are preventable, the coverage and quality of healthcare services in Nigeria has continued to fail women and children. The Senate knows that less than 20% of health facilities in Nigeria offer emergency obstetric care, and only 30% of deliveries are attended by skilled birth attendants. The Senate recognizes that under the auspices of Federal Ministry of Health and the Integrated Maternal, Newborn and Child Health strategy has been put together to revitalize primary health care in every local government and considerably extend coverage of key maternal and child health intervention. Further recognizes that under the Federal Ministry of Health, there is the National Strategic Plan of Action on Nutrition. The Senate is alarmed that these programs have contributed very little to reduce the maternal, newborn, and infant mortality rate in Nigeria. The Senate accordingly resolved mandate the Senate Committee on Women Affairs and the Senate Committee on Health to